Hi, my name is Michelle Gibb and I'm a nurse practitioner in wound management and founder and director of Wound Specialist Services. I started Wound Specialist Services in 2016 because I could see that there was a significant unmet need in the community to improve access to wound expertise. Our vision is to create a better life for people with or at risk for wounds and those caring for them. We've really worked very hard to try and achieve those goals of trying to improve access to wound expertise. We provide mostly telehealth services into residential aged care settings and the community care setting across the east coast of Australia. We work with health professionals from all different walks of life, helping to empower them, give them the knowledge, support and the skills that they need to be able to improve outcomes for people with wounds. I'm really excited every day to get out of bed and head into the office to try and see what we can do to improve outcomes for people with wounds. I've been involved in the specialty of wounds for more than 20 years, and every day is a new experience. You learn something new every day. I started out in the general practice setting. It was a really busy environment. There were about 10 GPs in the clinic, and it was like a small emergency department. And every day we would see people coming in with chronic wounds, leg ulcers, diabetic foot ulcers, traumatic surgical wounds, those sorts of things that were really proving challenging to treat. And it seemed that we were doing the same thing for them every day, and it really sparked my interest because I was thinking, oh, there must be something more that we can do. So that was really where I started on my wound care journey, and I just had a thirst for knowledge and wanted to learn as much as I could about this unique specialty. At that stage, wound management wasn't something that people really spoke about very much. It was very much a taboo subject. People didn't really want to talk about wounds that leaked, that smell, that impact on just about every aspect of a person's life. So I really started my quest for knowledge right as a new grad coming fresh out of uni in the general practice setting. And I've been really fortunate in my career to work in a whole range of different health service contexts, to meet people from all over the world who are battling with wounds or caring for people with wounds, to try and all come up with a solution to try and do things better, to improve outcomes for those people. So wound care for me is a real passion, and it's a lifelong journey that I'm embarked upon, and I love it and can't recommend it highly enough. Wounds are such an interesting phenomenon. They're really a symptom of an underlying health condition, and there's not really one particular wound type that takes my interest more than anything else. I probably have had a lot more experience in looking after people with lower limb ulceration, people presenting with atypical wounds where they've been everywhere, they've tried everything else, and then they come to a wound specialist as the last resort. So you do tend to see the unusual. And really in the wound specialty, it is very much like being a detective. You have to try and unravel and reveal all of those factors that could potentially be impacting on the wound healing process. So probably for me, atypical wounds are something that I see every day, but the wounds that are probably the most rewarding are, for me, lower limb ulceration. We often see people who suffer from wounds for such a long period of time, but the one thing that they've never had is an assessment or a diagnosis, and therefore they haven't had application of evidence-based practice. A lot of people are really amazed when they see me. They've had their wounds for 10, 20, 30 years, and within a matter of 8 to 12 weeks these wounds are completely healed. And it's not because we're doing rocket science or anything fantastic, it's just the fact that we're looking at what the cause of these wounds are and implementing the right treatment. So for me, wound care is something that everyone can do, and our job as wound specialists is to really help others to understand that they can do that too. Probably the best advice that I could give to people who are just starting out in wound care, no matter what discipline they might belong to, is that really no matter how simple or how complex a wound situation, it really all starts with a comprehensive assessment, not only of the wound itself, but the person with the wound. Really unraveling all of those layers is the key. If we can figure out what are the factors that are likely to be impacting on the wound healing process, we're more likely to be able to achieve our goals and objectives. And for many patients that we're looking after, wound healing isn't necessarily the ultimate outcome. It might simply be to reduce the volume of exudate or the odour associated with their wound, so that they can go down to the coffee shop and have a nice time with their mates. Or it might be to reduce that pain that they're experiencing that's impacting on every aspect of their lives. So for wound care, it is starting, the most important thing really is that assessment process, setting those goals and objectives and then working with the person with the wound to try and achieve those outcomes. Probably one story that I like to share the most, and that was one of the most rewarding experiences that I've ever had the opportunity to be involved with in wound care, is when young Sam came to see me, and he had suffered from a wound on his lower limb since the age of 6. He first presented to me when he was 17, and his goal was to try and be able to wear an Italian loafer to go to his school formal at the end of that year. He first presented to me in March, and he'd had a 15-year history of leg ulceration, and he'd been to see lots of different people. He had an extensive experience of having surgical intervention, grafting. He had experienced extreme pain, and he was extremely fearful of the whole process involved in wound care. In fact, I wasn't able to touch Sam for several weeks after he first came to see me. I literally stood with my hands behind my back and tried to build up that trust and relationship with him so that I could do something to help him. We're just through a process of talking with him and coaching, working through the process of what were his fears and trying to come up with some realistic, achievable objectives so that we could really direct that wound care process that were initial goals of treatment. Finally, when I could get my hands on Sam, we really started to see inroads into wound progress. We started to see a wound that was extremely painful become less painful. We found wound dressings that were acceptable to him and that were better able to control the symptoms that he was experiencing. To cut a long story short, eventually Sam's wound did heal to the point that he was able to go to his school formal, he was able to wear those Italian loafers, and fortunately that wound stayed healed for many number of months after he'd completed school. Unfortunately, because he does have a congenital malformation of the vascular and lymphatic system, that wound will be with him for the rest of his life, but we are getting extended periods of time now that he doesn't suffer from ulceration. And more to the point, he feels more empowered, he's got knowledge and skills, and when he is experiencing a problem, he's more readily able to reach out and seek assistance early on, rather than waiting for it to become something that's unmanageable. So for me, that was extremely rewarding, and I've got a good relationship with Sam to this very date. If I had 15 minutes with a politician to talk about nothing but wounds, what would I say? Well, where do you start? I think sharing those patient stories is really important, getting them to see the human side of what it's like to have a wound, to explain to them that it does impact on just about every aspect of a person's life, and that the things that they can do that would make a real difference to improving outcomes for people with wounds would be to, one, recognise that they are a problem and that they're one of the leading causes of hospitalisation for people in the community, and particularly in the residential aged care setting. That there needs to be better funding and resources available so that people can access the equipment that they need, the resources that they need in a timely way. One of the biggest barriers to improving outcomes is that they can't access things like compression therapy, for example, if they have a lower limb ulceration. And that means they're not getting the number one treatment that would result in better wound outcomes for that person with the wound. We could also talk about breaking down the barriers with funding. There's a real state, national or federal divide when it comes to funding, particularly in the residential sector. A lot of argy-bargy about who should pay for what and whose responsibility is what. We're all caring, we all live in the one country, we all really share the one pocket of money. So if we could share that around more equally, it would potentially improve access. We also need to look at ways that we can support the healthcare workforce more effectively so that we have more confident, trained, skilled professionals in all sorts of parts in Australia so that people have better access to healthcare. But the list is endless, and we could talk all day about the things that we need to really bring to the agenda when it comes to improving outcomes for people with wounds, but they're probably just some of my highlights. So what is the worst wound care advice that I've ever been given? Well, to be honest, you hear something new and wonderful every day. People go to extreme lengths to try and come up with solutions to improve their wounds. We hear about all different sorts of concoctions, and I must say there's probably not one thing that stands out more than anything else. Apart from probably recognizing that for these people, they are desperate, they are looking for any solution possible to improve the symptoms that they're experiencing. So it's not really for us to judge and be critical about what it is that they're using or what they've been doing, but rather to help them understand why it's probably not the most important thing or most appropriate strategy to try, and that there are other options that they could consider. So improving health literacy and understanding is really probably the first thing that we should do, but certainly we do have a list of different things that people try, and that's what's interesting about wound care, is because every day someone's got another story that they can share with you.